¿Ya puedo? ¿Sí?
Sí, perfecto.
Vale. Good afternoon, everyone. My name is Lara. I'm here with my colleague Luisa. We are from Portugal. We'll briefly present a paper entitled Crisis Management Planning in the Non-Profit Sector, the exploratory case of North Portugal on COVID-19. Yes, I'm so sorry. This will be the agenda of this presentation. This study used the context of the coronavirus and its spread disease to identify the level of crisis management preparedness of the North Portugal NPOs in response to an actual infectious disease pandemic with enormous numbers of spread disease and deaths, mainly in their senior segment. The extent to which the NPOs are strategically prepared to deal with crisis is an unknown fact. The preparation of NPO's crisis communication has received little attention in the investigation. Although the literature on crisis management is abundant, regarding the NPOs, little has been written on the subjects, given that few studies have explored the crisis management of the NPOs, and this is the gap of this study. Addressing this literature gap, the forthcoming qualitative study aims to know better about crises in NPOs, namely main critical issues, level of preparedness, and motives for the lack of preparation and planning, and finally, activities to improve crisis management planning and prevention. With the present summary of the literature, which does not pretend to be complete, I'm so sorry. This is our presentation of our table. Okay, a summary. With the perspective that time allows us, we can easily identify the 60s of the 20th century as the one in which we start to write about organizational crisis. One of the first authors to write about this subject was Charles Ehrman, and this author defined crisis as something that threatens the fundamental values of the organization, allows only a limited period of time for decision making, is unexpected by the organization, and originates in the relevant environment of the organization. Although crises can arise in multiple sizes, shapes, intensity, there are an immense number of classifications of crisis events on the literature, and crisis management researchers have classified crises into a matrix through cluster analysis and by categories. That there is no agreement on the universal classifications of crisis events. One example of types of crisis is given by Pearson and Mitroff. Also, recommendations for crisis management normally take a development stage approach, as models range from 3 to 5 stages, as we can see from the example given by Combs and Loffer. NPOs are some of at least understood segments of society. They are among the most crucial ones and are not immune to crisis. With the rapid development of the non-profit sector, which has taken place in the last 30 years, the number of NPOs has increased in number and complexity. The sector is represented by a diverse collection of institutions that mobilize individuals to achieve the common good. Before explaining this study, it's useful to know better the COVID-19 Portuguese context. Until September 7, occurred 1,824 deaths, of which 40% were in old people called nursing homes. And of these, 45% in the northern region. And about the age and gender, as we can see, they are the elders with more than 80 years and women the most affected. Besides the capital, Lisbon, the numbers of infected people are quite high in the north of Portugal, being the second region more affected with this pandemic disease. Now I will pass with my colleague, Luisa.
Okay, buenas tardes. This investigation uses a two-part data collection process. So based on the literature review, it started with this exploratory qualitative data collection that was done on the last May 2020, in the beginning of the crisis of this pandemic situation that we live today. So this started with 6 in-depth, semi-structured, face-to-face online interviews with 6 managers or executive directors representing 36 different social facilities. So they did represent social facilities as elder people nursing homes, as social centers, as shelter houses, drug addiction centers, street teams, social canteens and social centers, and so on. So a lot of social societies were represented by these managers that were responding to our study, our data collection with an interview guide, of course, and sampling, convenience sampling. So in here, we have that based on the secondary and primary data, we considered 2 great categories and we divided them into 8 subcategories or indicators based on Combs and Laufer study. So the first category was prevention and preparation on the pre-crisis phase, and then the second category was response on the crisis phase at the beginning as we were living that time. So following, we present the results obtained on each category. What can we say about this category? And you can see some examples, some references or transcriptions about each of these subcategories, which were defined as crisis definition in the view of these managers, the types of crises that they considered, the critical issues that they felt before this pandemic situation, before the beginning of Covid-19, the level of preparedness of NPOs, and then the reasons for the lack of preparedness that we see that was occurring. So the results that we can already speak about are that some respondents stated that this crisis was unpredictable for them. So a crisis is something unpredictable, and this one felt really difficult for them. As you see in the transcriptions, the first one, he says something like, hell fell on the institution, literally overnight. So they felt that it constrained and changed the course of events. Organizational models and practices were all different with this. About the types of crisis, you can see also the transcriptions, and some respondents mentioned health crisis, economic, financial, political, as they felt them in other times. And those were the main type of crisis that they recognize and know that exist. Also, about the main previous critical issues, these respondents, these managers, told us that they are related to low economic capacity that they always felt, the scarce financial resources also, the high dependence on supervisory entities, the establishment of partnerships, very important for them, with support institutions, with networking functioning. Also, the main issues were the lack of equipment, the lack of human resources, also some problems with demographic issues, with unemployment that had consequences on these NPOs, and finally, the ignorance or the devaluation of risk and planning. They didn't consider, were not used to consider this. Also, about the level of preparedness, which was one of our goals. About the level of preparedness, all respondents, we can state that, said that they were not prepared at all. No one could plan a pandemic crisis like COVID-19. We know that its size and seriousness are really important. So how you can, as you can see on the transcriptions, they told us that they were neither prepared nor mentalized for this. Nobody is prepared for a hurricane. Those are some of the words of our managers. About the reasons for this situation, this lack of preparation, this lack of planning. Issues, the ones that they were saying, is about issues of leadership, problems in the leadership, non-professional management, the lack of human resources, insufficient training about management, about planning, and some historical reasons. As you can see, one of the managers was saying, we have big ships coping with non-professional management for years. So a lot of problems were happening with time. For the other, about the category response on crisis management, it is possible to advance with this in mind, that the NPRs of this sample, of course, tend to react and to respond to crisis events. Simply doing this, following the guidelines of official bodies and creating contingency plans oriented by these entities. Almost all told us that they were just doing that. For the procedures, for the activities of crisis management, planning and prevention, it is important to say that the respondents, our managers, referred that there is a need to create circuits, to work on mirror teams, to reintroduce hygienic practices that were happening in the past and were and fell down. That should be created segmented routines, reception should be worked as transport protocols. Also important, it should be listed and prepared different volunteer platforms to get staff on health, on care, on support, so along with recruitment and partnerships to provide emergency human force, which was one of the biggest problems. Next, we can talk about conclusions, the main conclusions that we have. And it is important to say that despite the exploratory nature of these results, most of the arguments of recent literature were confirmed here. So conclusions about the level of preparedness, which is minimum, which is mainly reactive, can happen. Also, we have conclusions about the pre-crisis activities that were suggested by managers, for instance, a plan for each social facility, and others I would highlights the internal, external, and important nowadays, of course, the digital communication should be prepared in terms of teams, in terms of offices, as well recruitment and voluntary actions. Also, managers told us this, which is important to say. It must be well defined who does what, how that person should do that, what information should be conveyed for media, and how often. So this was important. Other processes should be put in practices in a routine basis, in a continuous way. They also told us that. And for conclusions also, for the crisis preparation, they told us that specific plans should include other things like complaint management, flows, teams, protocols, routines, and the reintroduction of hygienic practices. I'm not sure you are listening.
Yeah, but
yes. Okay.
No,
further research, just ending. Further research could be useful, could be interesting to be developed in some themes like risk assessment, like the lack of preparedness and why does this happen. And it would be interesting, and this was a surprise to see that it would be probably very interesting to confront leadership perspectives of these managers, these executive directors, with the perception of technical staff. The operational lenses of this technical staff seems to be very important, as they have a fundamental role to play and as they are really immersed on each specific context that these non-profit organizations live. Forthcoming, as I was saying, this investigation is a two-part data collection process, so quantitative and qualitative will be connected, and we have a mixed method approach going on. We now are doing a quantitative confirmatory study through an online survey applied, as you see, to a big database of more than 1,000 NPOs, in each of these NPOs, technical staff and managers will be answering in order to have a rich study. So we are quite anxious about the result of this ongoing process that will go on for a time. So I must thank you all for your kind attention. Gracias, muchas gracias por vuestra atención.